that for the NAT, the different regions can take its own measures based on its regional situation. So you could see here in Shanghai, the measures we are taking. I also share with you the same interest with you, is that whether the situation can be controlled here in Shanghai. We don't want to see any overwhelmed hospital from happening. If you want to see a guarantee yes or no, controlled or not, I believe you need to ask this question to the disease controlling department. What I can share with you is the nature of the diseases. So you could see with the different variants emerged from 2020 to today. Right now we could see that right now the Omicron already developed the second generation. And BA2 right now is the dominant variant in Shanghai for this round of a surge in number. So which means one person can get 9.5 infected. So that's R0 number. So this R0 number is 3 to 5 times than the R0 in 2020. So which means one person can get 10 people infected. And also the incubation time is shortened, which means within 3 days, these 10 people can be infected. At the very early time, just one person infected one person. As you could see that right now in 3 days, one person infected 10 people, and in 6 days, this number will be huge. And in 10 days, there will be 1,000 people infected. So you could see that this is a really exploding number. So we have to control the spreading of the virus. Today is 25th of March. It's right now already half months of this wave in Shanghai. So that number could probably reach to 10,000 people infected if there is no COVID-19 control. And today we look at the number, it's around 1,000 cases, including confirmed plus the asymptomatic cases. So people asking that whether we should practice even stricter measures to control the spread of the virus. So that depends on the measures we are taking here in Shanghai. And in the previous press conference, the prevention and control experts also made many explanations. Here I would like to say, judging from the current situation in terms of the transmissibility, the current wave caused by the BA2 variant in Shanghai right now, we are practicing the COVID-19 preventing measures. Right now, we curve that's the exponent increasing in terms of the infected number. Let's say if there is no COVID-19 controlling practice, then this number will growing even further. So right now we are conducting this dynamic NAT. So if, let's say, we have seen that a curve is flattening in the controlled area, then we can say that the total number will for sure decreasing. Right now, we are at on the rise in terms of the confirmed numbers, but the thing is that it's not increasing in a exponent number. So which means the growing rate of the confirmed cases is slowing down. At the outside of this wave, it's around the 10th of March. The number of confirmed cases in non-controlled areas was increasing faster. Right now, we controlled this increase, and right now, we could see that only 10% of the confirmed cases from the non-controlled areas. And we can see that this should be rely on everyone's efforts to control the spread of the virus. And also when it comes to NAT, we could see that right now we're conducting citywide dynamic NAT, that everyone will be included in this NAT test. We don't know that it already include everyone, so we also call on everyone's support to participate in the NAT, and we see different compound. We also want to practice the targeted measures, so you could see there will be more communities open, so that will be no longer in the controlled or lockdown area. So back to your question, whether we reach a tipping point. So when it comes to Omicron, all the practice or measures we are taking right now, no matter it's working at home or a study online, no outing, so we cannot lower the R0 number below 1. And we could still see that the curve will increase in the exponent number. But if we practice the NAT, that's citywide NAT, for sure will control the R0 number below 1. So you could see that also the officials from the health committee also here. So we also do our best to promote and educate people the role and importance of NAT. We still call on everyone's support. We need to get everyone tested, because if we get everyone tested, we can control the R0 number below 1. So before we're reaching that tipping point, I also may invite you to pay a notice that if you're looking at that's the number of confirmed cases from non-controlled area, if that number is decreasing, then we will very soon reaching that tipping point. But yes, right now the situation is really critical here in Shanghai in terms of controlling COVID-19 situation. So we should everyone pitch in to screen out the potential cases by conducting NAT. So we can shorten the time of the lockdown of the different community. It's an all-out effort. It's also an all-out war against the virus. We will eventually win the battle, but there's still a long journey to go. So you could see right now in a comparatively long time we can control the spread of the virus. So you could see the number of confirmed cases will at a low level, but based on the confirmed cases number, we will dynamically adjust our controlling measures. So today, if I say right now we reached the tipping points, then you see, oh well, we're in a very beautiful world. Actually, there's no country could win the battle against the COVID-19 in a very, very short time. It's really time-consuming, so please be patient, and we need to be courage, and we need to be smart enough to deal with this virus. Still, we call on everyone to pitch in to deal with this virus. If you only rely on experts, like myself, I only could treat certain number of patients. So still we call on everyone for the concerted efforts to control the virus. Thank you. Xinhua News Agency. My question to Mr. Wu. In the recent 2 days, for the key areas, we have seen another round of NAT conducted, and also saying that they want to shorten the scope of the controlled areas. For people not tested, what they need to do. Thank you for your question. I believe this is also in public interest. Starting from 16th of March to 20th of March, we have organized a classified NAT for targeted areas and a non-targeted area. I explained this before. So it's a parallel work in the different regions. Based on the preliminary study, 2 days ago, we selected the targeted regions for another round of NAT. So that's the yesterday and the day before yesterday. This round of NAT has covered around 20,000 people. For the COVID-19 positive cases screened out in this round of NAT, will be quarantined and also based on its clinical symptom and based on the results of this round of NAT. If it's all showed that COVID-19 negative, which means there's no confirmed cases or asymptomatic cases found, then which means this area will be freed. So which means the control or the lockdown measures will be lifted. If we found the COVID positive cases, then we will see that the series of that cases, so that will based on the different classification of risk to depend on the what kind of practice we could be practice on different community. So some communities could be lifted strict measures. Some communities will depend on the newly found cases with COVID positive. So for NAT and the targeted area and the non-targeted area, the majority of the residents already been tested, but still we have seen a few residents haven't been tested even once. So yesterday evening, we released an announcement on our official website saying that the residents after the 16th of March, if they haven't been tested, then they need to go to the nearby NAT booths. So either could be an agency or the hospital, fever clinic, and they need to get tested. And also, if they're not tested, then their health code will no longer be green. So that will be impact their way of travel. So I'm here to give the announcement for anyone. If you haven't been tested after March 16th, please go to visit a booth to be tested. Thank you. My question to Mr. Jiang from a Putuo district. I would like to know that the Putuo code. After the outside of March, we have applied this venue code. This is just a new scenario of the original code application. So this is a designated code for different venues. So you just scan by any your app, then that will show your health code. So they will be improve the effectiveness of our work and also will get all the information aligned. So this is a very convenient code. So from the user experience, so this will be very convenient for you to show your health condition and also your information registered. So either the working office or the shopping mall, the different venues, they also welcome this code. In terms of the regional disease control, we focus on a farmer market, a shopping mall with a high density of population flow. We established this data analysis mechanism. So these numbers will be registered, and for the people with abnormal code color, and will be do the following work. So that also help us to get the dynamic information. 18th of March, and one of the market, we have seen a more than 10,000 times of code scanned. So this is a quite abnormal situation, and we also ask the market to say that they need to get more supplies storage. I believe this is very important to introduce this application to the residents. So we ask everyone, every agency, every company, shopping mall to practice role and responsibilities, and also ask people to be cooperated to scan the code. Till yesterday evening, 35 shopping malls, 32 the farmer market, and the key high-density population flow areas are covered by this code. Daily scan numbers reached 400,000 times. We still see the room for improvement. There are some small convenience store. They may not have the qualification to apply for that code. And for elderly people, if it's not convenient to use smartphone, or for people from other cities or provinces, they may not easier to use this code or can't apply this code. So we still register these people's information by writing. So going forward, we will also would like to include the information of that vaccination and the NAT result all included in this code. So just by scan one code, that reflects all your COVID-19 related information. Last question, please.
谢谢发言人，我是新民晚报的记者。
Evening. A question to Mr. Zhang Wenhong. As you mentioned, right now we're still at a higher number in terms of confirmed cases, and some communities already lifted their measures. Still, wearing masks still works. Any suggestions? Thank you for your question. Masks have been asked for so many years, right? From the very beginning of the COVID-19 outbreak. I believe no further words to given to this question to talk about how to wear a mask. Back to your question, still yes, wearing masks still very important. Wearing masks can stop the spreading of the Omicron. I say not 100%, but wearing masks are one of the crucial measures to protect ourselves against Omicron. Right now, we're facing the second generation of Omicron. We're all under a big pressure to stop its spreading. The role of masks actually is very limited, but you need to bring all the different measures together in order to stop the spreading of the COVID-19, especially Omicron. We're looking at the worldwide. We have already got many scientific numbers, and we also know exactly the role of mask play in order to lower the R0, and what's the role of the working from home, what's the role of the closing theaters, and what's the role played by the studying at home or the online studies. All these measures, we all have scientific numbers to see these measures, how that helps to lower the R0 number. We talk about all these measures putting together are the most effective weapons for us to kill the virus. There's no single MPI as a non-prescription action can kill the virus by itself. We talk about that we stop all the activities, no one get out, then we could probably kill the virus. But still, we want to have a normal life. We want to resume the work and production. Then we need to rely on multiple measures. Wearing mask is the most easiest one. So don't go. So if you go to the density areas, please do wear a mask. And if the situation is quite severe, and we can do the remote working, so it's work from home. And for schools, they also have their effective practice. And just now, Mr. Jiang mentioned about the code, that the venue-specific code also very important. And also Mr. Wu mentioned about the NAT ODs show you that the testing is also one of the most effective way in terms of the non-prescription action. If all these MPA all can be implemented into its letters, and we can get the result of NAT as soon as possible, so we could see if we could do ODs, we could lower the R0 number below 1. But still, ODs take time. If we do these matters in a quite good manner, then we will very soon see the R0 below 1. If we not do all these measures in a quite accurate way, then the R0 number will be slowed down in a very longer time. So you talk about wearing masks as one of the weapons. We also have more weapons at our disposal. We need to use all these weapons together to kill this weapon, to kill this virus. We want to control the spread of the virus. By the end of the day, our goal is to mask off. Of course, we want to see a day when this day comes, we can take off our mask. But before that, we need to get our booster shot. The situation in Hong Kong shows us once again that the booster play a very important role to lower the fatal number and also the hospitalized number and also the serious cases number. We talk about elderly people, the people with underlying diseases, please get your booster shot. So we talk about it's not just easy to say by putting on of your mask. We put on our mask means that right now we would like to use all the available measures we have to protect ourselves against the virus. And one day we take off the mask, which means that's our victory day. So by the end of the day, we want to see that day come, and for sure we will see that day coming to us. We want to see a day that we mask off. We don't want our young generations, when they're born, they just know that the wearing mask is one of the must thing to do. No one country pay no efforts to win the battle. We believe China will for sure find our way out that fitting our condition, and for sure will always put people's life and safety before everything else. Thank you for your question. That's the end of the Q&A session. If you have further questions, please also report to the Health Commission, and we will always keep you updated regarding the COVID-19 situation in Shanghai. That's for today's presser. Thank you.